All right, I did my strategic audit simulation on the Office of Correctional Health Care, which is a division of the Ohio Department of Rehabilitation and Corrections. The Office of Correctional Health Care is a combination of bureaus of mental health services, medical services, and recovery services that work together to provide the most efficient medical care, mental health care, and dental care to inmates in the ODRC. I interviewed the Chief of Healthcare Operations and Fiscal Management. The current mission of the Office of Correctional Healthcare is, our mission is to promote optimal wellness through identification and treatment of health problems while providing patient education associated with health conditions and disease prevention. We will foster an atmosphere that promotes comprehensive, compassionate, quality, professional healthcare through education, provisions of resources, clinical oversight, and administrative support. To continue working to maintain and improve the department's mission statement, they continue to annually update their goals and objectives, and their goals currently range from staff training to ensure staff is meeting the needs of their inmates, to evaluating and enhancing the movement and placement of individuals within the healthcare system. Corporate governance. The ODRC has a clearly defined corporate governance structure in place. The ultimate head of the Ohio Department of Rehabilitation and Corrections is the state governor, who at this moment is Governor John Kasich. The governor appoints the Director of Rehabilitations and Corrections, also known as a Chief Administrative Officer. The director then has complete power and authority over the department with control and supervision of any department affairs. There are several other chiefs and managers that are lead decision makers in their department. These positions are shown on the chart. The Chief of Healthcare and Fiscal Operations, Managing Director of Organizational Development Areas, Managing Director of Court and Community, and Managing Director of Risk Management. The very defined corporate structure of the ODRC allows for a greater understanding and clarity of the distinct duties and roles of each subdepartment. My main analysis is based on the Office of Correctional Health Care, the OCHC, but as you can see from the following chart, which outlines the corporate governance structure of the Ohio Department of Rehabilitation and Corrections, there are several positions that play a role over and above the Chief of Healthcare and Fiscal Management for the department. During my SWOT analysis, you will see here the different internal and external factors that have an impact on the Office of Correctional Health Care. Internal factors, some strengths are their strategic planning. They are very big on their strategic planning and do a good job with it. Their slogan, one patient, one team, teams in communication and leadership roles. Their weaknesses may be the OCHC training, recovery services, and lack of space and budget control. External factor opportunities are farmland sales, electronic health records, recidivism, threats, lack of mental health facilities, changes in federal guidelines and Medicaid. The current mission for the OCHC's strategic plan for 2016 is to pursue excellence and promote optimal wellness by providing personalized, integrated services. The objectives for the strategic plan for 2016 follow pretty closely with the missions of the department and are very specific toward reaching their goals. The following SFAS matrix is a good summary of the ODRC's current internal and external factors from the previous chart that have helped guide them to their strategic planning objectives for 2016. One patient, one team is a saying that was stated by an employee in one of the annual OCHC strategic planning retreats and has become a very important strength of the company. This saying had a 0.8 weighted score, which is higher because it's a long-term goal in the department, and they will have to continually be working on that. And it's a very important piece of their internal strengths. The OCHC has a lot of strong leaders in management, which allows for the Chief of Healthcare and Fiscal Planning to break down his department into teams led by these leaders. This definitely is a strength of the department, which can help them reach their goals and objectives. Budget control is extremely important and is an area where progress has been made, but at the same time, they still have a lot of improvements that need to be made to accommodate the number of inmates in the system and allow for the department to make changes and upgrades in technology, employee training, facilities, and other programs that will enhance the delivery and care the inmates receive. They have one of the best recidivism rates in the country at about 30%, and that means inmates who have been released and then come back, so that's at about 30%. Although this is a good statistic, we have one of the best in the country. A big goal is to make a different approach to treatment and recovery of addictions and treatment of mental health. Taking an approach to that addresses these issues before an inmate is released, gives the inmates a solid foundation to work from upon their release, which would help decrease their chances of ending up back in the system. This area of the matrix ranking was 0.8. Medicaid can be difficult for those being released from prison to navigate, or many times those released just do not take the initiative to enroll and then are unable to get the health care that they need, such as medications and mental health. The OCHC is rolling out a plan to educate and enroll inmates on Medicaid before they're released, so they're able to maintain the care they are needing, which could many times help prevent them from making choices that would lead them back into the same situation. Electronic health records are also a current issue. There's been a big changeover. The department is currently about 85% finished with that rollout, and this is to increase and enhance the delivery of medical services throughout the department, focusing specifically on areas of medical scheduling, clinical continuity of care, and medical evaluation. Okay, so the current goal for 2016 is to increase mental health services to address the mental health needs of our patients and those in restrictive housing units. To meet this goal, many objectives were listed, including opening a 94-bed behavioral health unit at Madison Correctional Institution, creating 2 regional day treatment programs at level 3 institutions, and expanding residential treatment units by opening 80 beds at Grafton Correctional Institutions. Now, these were all focuses on those currently incarcerated, but one of their main focuses now is to improve programs for once they have been released. According to a 2015 Columbus Dispatch article, Dr. Catherine Burns, chief psychiatrist in the prison system, said people with mental illnesses typically get arrested more often because their untreated behavior brings them to conflict with law enforcement. In the legal system, they have fewer chances of getting community treatment or probation because judges have limited options. The offenders have burned bridges with family members, and in the community, in prison is often the last resort. In other words, all the work that's being done to stabilize mental health of inmates inside the prison and their behavioral health units may stick with them some after they're released from prison, but many end up right back in the system again. Many of these inmates who are not considered to be mentally unstable enough to be admitted to a facility outside of prison are essentially being criminalized for their illness. According to the National Institute of Corrections, 17% of jail population in the U.S. has a serious mental illness and 68% has a substance use disorder. An estimated 72% of the jail population has co-occurring substance use disorder when a serious mental illness is diagnosed. By diverting the appropriate individuals from county jails and prisons to treatment and preventing recidivism, communities can see a significant reduction in spending. In Ohio, the average cost of addiction treatment in the community is $1,600. That's without medicated assisted treatment. And the average cost of mental health treatment, including 2 medications, is $7,500 per year. Whereas the cost, it costs almost $25,000 a year to incarcerate an adult in prison. On a daily basis, the cost of incarcerating an offender in prison is $69.23. A day in jail is about $75, while the cost of parole for 1 day is $11.54. These statistics are alarming and make it very clear that it is most cost effective and beneficial for those with mental illnesses and addictions to have access to treatment and options outside the community. One recommended strategy for this would be to assign caseworkers to all individuals diagnosed with a mental illness and being released from jail or prison. The caseworker would also, I'm really off there. Okay. The caseworker will also make various attempts to connect with someone in a supportive role and finding them a mentor. The different areas that will need to be evaluated are the mentor's criminal background and mental health background, finding out if they've been in the system and proven clean of drugs, criminal activity, and if they're in good standings with their mental health care provider. This mentor will then act similar to like an AA mentor. So they'll have a supportive role for that person to go to, and they can help them work through all their issues outside of jail or prison. The pros are it would save the state money, it would give the release support, and the cons would be how to evaluate the stability of their mentor. There would be 5 teams based on regions. These teams would be psychiatrists, psychologists, nurses, social workers, activity therapists, corrections officers, unit managers, and caseworkers. The caseworkers would then report to the medical manager of the region, and the regional teams would meet monthly. For the mentor program, there would be a screening process, and that mentor would work very closely with the case manager. This encourages doctor's appointments, recovery meetings, and medication continuation. The long-term goal is to reduce recidivism rates, which are currently at 30%. The daily cost of one inmate is $62.56. If we reduce the number of inmates every year by 500, we will be saving the state almost $12 million. So if we could get 500 of those 20,000 inmates to continue with their recovery and their mental health recovery and stabilization, it could save the state $12 million. The teams for each region would meet monthly in a central location to discuss how the plan is working and give suggestions on any areas that can be improved. This reinforces the need for a formal plan of action. Taxpayers pay the hefty tab for the 41% of 2,510 inmates in the Ohio Reformatory for Women in Marysville are on mental health caseloads. This reinforces the need for a formal plan of action. Taxpayers pay the hefty tab for the 10,596 mentally ill inmates. The Ohio Department of Rehabilitation and Corrections spent $41.7 million on mental health care and medications in the fiscal year of 2014, and it is projected that they're going to spend $49 million this year. This is on top of the $22,836 annual overall cost per inmate. The evaluation and control system in the OCHC has excellent communication and strategic systems to provide quality feedback. Every year, the Chief of Healthcare and Fiscal Management for the OCHC holds a strategic planning retreat. Here, employees from every level are encouraged to express any concerns they have on any level and also express feedback on ideas they feel they can improve for the quality of patient care within all correction facilities. This retreat is where the phrase "one patient, one team" actually originated. The goal of increasing the success of those with mental illness or who are in recovery post-release will have its own set of leaders who are appointed by Mr. Hudson, and these leaders will be given a few weeks to set up a timeline of how their goal will be reached by their team. There will be a specific deadline for each step in the process to reach their goals. Every month, Mr. Hudson will meet with the leaders of the group and discuss the timeline and the progress of the goal, and it will be determined if any changes need to be made if they are ahead of schedule. The timeline is a system used to make sure that there is adequate progress being made towards the goal and that there is not a loss of momentum halfway through. This plan will be reevaluated again in 2011 Strategic Planning Retreat. And that is it. Is there any questions? Or are there any questions?
I have a question, Sabrina.
Sure.
Would the mentor program, would that be a paid program, or would that just be a volunteer basis, kind of like the AA?
That would be a volunteer basis, like
Okay.
the AA. So it would kind of give that volunteer and the inmate that's being released kind of support on both ends in a way. And I feel maybe if that inmate being released has that guidance from somebody that's been in their same position, they might depend on them more and have more trust in them, helping them succeed.
All right, very good.
Anybody else?
I have a question too.
Yeah.
You said to decrease like recidivism.
Mm-hmm.
You said that it's already at 30%. Is there no other ways that you could decrease that to save the state more money?
Right now, their biggest focus though is on the mental health care and recovery. So right now, what they're trying to do is find the best ways to help these inmates after they are released from prison. So kind of finding a plan that's going to help for them from returning back. There probably are different directions we could go on, many different levels, not just though with those with mental health issues and recovery issues. But this would just be one route to try. Does that make sense?
Yes. Okay. Thank you.
Mm-hmm.
So like anyone can volunteer to be a mentor? Like there's like no like background check or anything like that?
No, I put in there, it would be somebody that's been through the system already, and that would be one specific part of the plan that would really need to be planned out. How are they going to control? Are they going to do continuous, drug screenings on them? They're really going to have to check into their background. So that's going to be one part of the process that's going to have to really be defined, is how they're going to control that mentor.
All right, sounds good.
Okay.
What?
Recording.
All right, my name is Sarah Kirkman, and I am doing my presentation over Strategic Audit Simulation Project. The Indiana Blood Center has a different department which makes up the organization, such as production, administration, distribution, and testing. All employees of the Indiana Blood Center work together for one common cause. The cause is to supply 60-plus hospitals in Indiana with safe, pure, and effective blood products. Blood transfusions save patients' lives when they need blood products. Natural physical environment. Weather plays a big part of the natural physical environment of the blood drives. During the winter months, blood drives could start late or even become canceled due to dangerous weather conditions. Social environment. The Indiana Blood Center, like a lot of healthcare organizations, was affected by the Affordable Care Act of 2010. Hospitals had to find ways to save money, and ordering blood was one of the first things they cut back. Task environment. In the past couple of years, the Indiana Blood Center has been forced to compete with American Red Cross for the blood drives in hospitals to purchase the blood supply. The IBC mission statement is very empowering to both employees and donors. Blood is life is the first sentence in the mission statement. IBC provides a continuous, safe, and adequate supply of blood products serving the Indiana communities first and then helping with services elsewhere if need be. The IBC has a vision to always strive to meet the needs of patient, donor, and customers. The values of IBC are shared and believed by every employee. The values are respect, open communication, recognition, and rewards. The current mission, vision, and values reflect the corporation's inversion. And the Indiana Blood Center relies on donors to make their vision become a reality. Without donors, the IBC would not be able to supply Indiana hospitals with blood products. Without blood products, hospitals would not be able to save lives. The Indiana Blood Center has been experiencing a high turnover in employees. Jennifer Jones, the executive assistant of the Indiana Blood Center, discussed the board members of their functions. Board members do not own a significant share of stocks or get time or compensation for their time or presence. There is not a blood center stock, and they do not have any stock in the Indiana Blood Center. No one can purchase IBC stock. Questions for Jones: what do the board members contribute or to the corporation in terms of knowledge, skill, and background? Jones answers: our board members have a wide variety of knowledge, skills, and backgrounds. Their knowledge and background consists of legal, health, hospital, human resources, financial, general business management, marketing, and non-for-profit. Jones states that the board members have served anywhere from 6 to 25 plus years. The last question was, what is their level of involvement in strategic management? Do they merely rubber stamp the management proposals, or do they actively participate and suggest future directions? Do they evaluate management proposals in the terms of environmental sustainability? Jennifer replies, their levels of involvement in strategic management is very limited. They do not actively participate in strategic planning. They give approval on the top management proposals, but do not make suggestions on future directions. They do make suggestions on future directions if they feel proposals aren't steering the right direction. The strengths is the IBC has a great teamwork. The team is good at collecting safe and pure blood for patients. The company offers great benefits such as 401k, retirement plan, and paid time off, and the customer service is a huge strength for the IBC. Weakness is the number one weakness in the Indiana Blood Center is work-life balance. The work schedule itself is the hardest part of working for the Blood Center. The schedule is operated on what the company calls a swing shift. There is not a traditional first, second, third shift, only a guaranteed 10-hour window before the next shift starts. Also, the communication at the IBC is very poor. The main source of communication is email. Lastly, the IBC is having trouble with employee turnover. In the past, IBC would lose newly hired employees after a couple of weeks of the crazy schedule, but now the IBC is losing their seasonal staff that have been employed for over 5 years. The opportunity is the IBC uses the high-tech scheduling computer program. However, the department is not utilizing all of its functions. The software can help schedule employees on blood drives closer to their homes, schedule with preferences to morning or afternoon shifts, and provide employees with a more stable schedule. The major threat is that Blood Center is the Red Cross recruiting the Indiana Blood Center employees. There are many employees who are not happy with the IBC because of the schedule. 2 years ago, the Red Cross took 2 major hospitals away from the IBC. The SFAS, after gathering information from the SWOT, the analysts, the information can be put into 2 different tables, the IFAS and the EFAS. The tables make a powerful analytical tool when combined in the SFAS table, which you can see in my next 3 slides. In the strategic alternatives, there are 3 major problems with the health With the schedule, there's work-life balance, 10-hour turnaround, and not enough staff. The Indiana Blood Center needs to hire a software solution support manager for Hemisphere. Hemisphere is the powerful software tool to help blood centers manage, measure, and organize effective blood drives by uniting recruitment and staff scheduling solutions. This software will help make sure employees are working near their home, are receiving preferred shift times, and receiving more consistent schedules. This will improve customer service, and it will also keep employees from finding new jobs, especially with the competition. Feasible alternative. Number 1 is a current employee with a bachelor's degree in computer science. Pros, the blood center already has a software and will offer current employee a promotion to a management level. Cons, we'll have to teach the current employee about the schedule in Hemisphere. 2, send current scheduling employee to be certified in Hemisphere. Pro, the blood center already has the software. Scheduling employee are familiar with the software and will offer current employees a promotion to management level. Cons, employment will not have a degree. Number 3, hire a Hemisphere expert from an outside organization. Pros, the blood center already has the software. New employee will already be certified. New employee will bring new perspective into the scheduling department. Cons, they will have to be taught about the blood center. Implementation. What strategies will be implemented? The plan will be modeled after the stability strategy. The Indiana Blood Center will not add any new blood collection contracts at the current time. Who will implement this strategy? There will be a panel of employees that will implement the strategy. This will be a very diverse group of employees. When will the strategy be implemented? The panel will meet every Tuesday and Thursday for 6 months to create and carry out and evaluate the plan. Each Thursday, the HR director will generate a report and send it to the CEO of the blood center. Where will this strategy be implemented? Currently, the blood center is having trouble staffing blood drives to collect enough blood to fill their orders. The new strategy will be a short-term solution for the overworked employees of the blood center. In hopes of the deadline of 6 months, the panel will promote or hire a Hemisphere expert to utilize the potential of the software. How will the strategy be implemented? The blood center will continue to use the schedule software that they already purchased. An expert in Hemisphere will be able to maximize the program to ensure employees' schedules are more work-life balanced. With balanced work-life schedule, the blood center will then retain more employees. Evaluation and control. With the scorecard approach as seen on this page, it is capable of providing necessary feedback on implementation activities and performances. It will pinpoint if the new position is currently a work-life balance schedule and retaining employees. After the software solution support manager for Hemisphere is trained in all functions, the schedule should be balanced with work-life for employees. The evaluation information should be available after the 6 months of new work-life balance schedule. If the result shows a positive outcome, it could be used as a benchmark to other blood centers who use Hemisphere. The reward of hiring a new employee to be a software support manager will benefit the whole blood center. Any questions?
I have a question. Why is the turnover rate so bad at your place of employment?
Number one reason is for the pretty crazy schedule. Like I said, that it's kind of like a swing shift on steroids, so you only get a 10-hour turnaround. So one day you could work at 6 in the morning and get off at 2, and then the next day you might work at 11 o'clock in the morning and get off at 10. But then you can't work again until 8 the next morning, but you just got off at 10, so everyone's pretty much sleep deprived there.
Gotcha.
Oh, so no one has like set schedules, like they like change, I guess, weekly.
Yep, you
That-
get your schedule every 2 weeks, and every day is different.
Okay, that's what I was going to ask, if they knew in advance when they were supposed to work.
Yep, you have to pretty much schedule your whole life in 2 weeks in advance to be able to do the things you need to do, like doctor's appointments, schoolwork, um, if you work out, eating, sleeping, hanging out, having a good, going out and having a good time. Everything has to be scheduled 2 weeks in advance so you can get it in.
So you cannot even develop like a good sleeping pattern because like you're pretty much changing every other, like you know what I mean, like every day
Yep.
or every other day you're not sleeping at the same time. So no wonder why like I guess the turnover rate is like so high. I bet people have like a lot of like physical issues with that.
Yeah, well, especially if you have families, because our child care is always going to have to be different. You have to have a stable support system. I actually just got a new job, but I worked at the Indiana Blood Center for 5 years. And the only reason why I got a new job is because I can't take it anymore because I'm so tired.
How long have they had this type of scheduling for their employees in effect? Because that just seems like
Um,
something they would have nipped kind of
Yep.
almost
Well, the
immediately.
reason why they don't change it is because we are at the mercy of donors. So when they schedule a blood drive, we have to go. And we can't say, well, we can only do blood drives from 8 in the morning till 5 at night, or we have to be at the mercy of when they're available to donate.
I was gonna say, I wonder if there's a way for her to do like volunteer, like you have set hours, but then you have some sort of volunteer on-call type. I don't know. It's
Yeah,
interesting, very
it's pretty
interesting.
messed up. Yes, it's very, very messed up, but the nice thing is you aren't doing the same thing every day. You're not going to the same place every day, but also it wears on your sleep because sometimes you have to go to work at 3:30 in the morning,
Yes.
so that is not fun.
Well, and I would even think if there's, yeah, okay. Okay,
Yeah, it's bad.
there's too many questions to even figure that one out.
Get into it. Yeah.
All right.
All right. Anyone else have any other questions?
I think we're good.
All right.
So my name is Pedro Velasquez, and I did my project on Homeport Columbus. Homeport Columbus, it was founded in 1987, and it started as a small organization. It had under 100 employees at the beginning, and maybe until the past few years. Now it's a multi-million-dollar organization, and it contributes to a huge amount of like investments and growth for not only Columbus but for Ohio. Also, Homeport is a private nonprofit organization, and their mission is to create and preserve stable like neighborhoods and communities. So their main goal it's not to make one person in the community strong. It's to like help everybody in that community in order for them to succeed. So instead of like the organization is working with one person in that neighborhood or in that block, they will work with like everybody on the same block. That way everybody gets the same services from the same organization. All of them can work together. The person I interviewed or worked with for this project was Win. She has a bachelor's in journalism from Ohio State, master's from the Methodist Theological School in Ohio. She is the community engagement and resident leadership initiatives leader and affordable housing director of the community at Homeport. Like her job, she pretty much just supervises like the whole organization, but since like all the staff has to go out into that community, like every now and then she would also go out and maybe show up 5 or like 10 minutes after the worker leaves from having a meeting with the client, she would like walk in like 10 minutes later and ask the client their experience and everything without having the staff member knowing. So it's very interesting how she becomes part, like how she goes after like the staff member to ask for feedback about how their experience was and everything. She also uh, tries to volunteer in most of the events that Homeport has. So they have like community like parties or don't like sometimes they get do like food drives or things like that that will help the community. For the external environment, like some of the issues that the organization experiences is that like sometimes when they have to meet a client, since like most of them have low resources, like some of them do not have like they don't live in like the best conditions, so they might not have ACs, like an air conditioner. So when it's like 90 degrees, like the staff member cannot have a pleasant conversation with the client. So they have to pick him up and maybe drive him to like a local, like McDonald's or anywhere nearby where they can like actually have a conversation without having to like suffocate in like the heat and things like that. There are also issues when like if like the weather is really bad. Some of the it's been known like from like the whole neighborhood to lose power. So then Homeport has to send staff members to like try to help as much as they can. Maybe like provide flashlights and things like that. But everything that Homeport provides, it's from like it's by them going the extra mile. Like not like they will not charge the client. Like every summer they have uh, they buy backpacks and provide them to like the kids from the clients that have like low income. That way, like the parents don't have to buy them book bags. So they do a book bag drive, and then they collect also like books and school supplies. Uh, in like the social environment, they don't have a big issue trying to compete with other organizations because Homeport started really small and now it has become known in Ohio and probably and like in Ohio in the United States and like slowly getting known around, like across the world because not only of the service they provide but like their success like they have like just looking at their revenue it's in the millions now, so it's getting known and all the organizations want to know what they did and how they did it in order to become so big so fast. Like in the last 2 years they had to move to another facility because they had to hire more staff in order from all the new clients that we're getting, so they had to move into a bigger facility to hire new staff in order to be able to provide services from like the huge demand they have. So there's not much competition from with that Homeport has from other organizations. Like everybody just tries to get their services from Homeport. And the nice thing is like since they try to work with like everybody in the community, like the word gets around. So one person in that community will tell the other one, and then like at the end, Homeport it's able to have more like clients in like the whole community. So it's not like they have to have one client in one sector of Columbus and then another one on the other part. Like they are in charge of whole communities. The current situation, as we can see, like Homeport has contributed to with more than 487 million to our local economy in less than 5 years. And also, a university in England did a research about Homeport because of how fast they grown and like how much money they're contributing to the economy in Ohio. And it's one of the few organizations that has contributed over 1.4 billion to Ohio's economy. And the organization has multiple policies for both the staff and clients. Like one of the things that got them all this success is like they always want to know more about the client and what the client wants, and they're always willing to go the extra mile. So everybody knows that, and then the word gets around and everybody starts wanting to be a client of Homeport. For the corporate governance structure, Bruce is the president and CEO of the organization, and he worked as the vice president, as the senior vice president at J.P. Morgan Chase before. Craig Murphy is the senior vice president of operations and programs. When I interned there, I got the opportunity to like talk and interact whenever I had time with all the like the board members and like the corporate staff there. And the nice thing was that everybody was, or still is, like really, really friendly. And that's another thing that like the clients see, like the president of the organization can be there, like Bruce can be there, and he will like walk up to you and talk to you and everything. Like there's no, like you don't get that feeling that you're not able to talk to him because he's the president or at another maybe like educational or like economic level than you are. Like he's super friendly and he interacts with every single person that walks through that door. If they're like nearby, he'll stop by and talk to them and everything, which is really nice. Like I have not seen a lot of that in other organizations. One for the strategic factors, one of the problems the organization has is that the clients take advantage, not like advantage, but like are always asking for more from the organization, which is like taking advantage on some point. Before, like the organization always tries to give as much as they can, so they would have seminars and give food baskets to their clients. So they had issues before where clients will show up, take the food basket, and leave, and not even stay or like stay for the seminar. So after that, they would only give the food baskets for people that stay the whole seminar, or like the whole seminar, or like most of it. And when I was not working for them, but when I was an intern, I volunteered for one of the seminars, and people would walk up, and once they got the information that they would only get the food basket if they stayed towards the end of the seminar, they would just leave, and or like just argue that why couldn't they get the food basket. So for this, I think that one of the best options would be changing the mission statement. That way, the clients can have a better view of the organization and what it's asked from them, or like what the organization is like expecting from them. And we also figured out that just by giving all the time, it could also be a bad thing for the clients, because if, let's say, they move to another location or to another state, they will not be able to get services from Homeport. So when they move into their new organization and they already have these habits of like asking, and not given anything on return, like some other organizations might just cut them out and not give services to them. And it will also be frustrating for them when they have to interact with another organization that is not willing to help as much as Homeport. One of the solutions would be to like either gather as much information as they can from like what are they doing where the clients are demanding more and more, not giving anything back. But the main solution would be to change the mission statement and give goals to the staff in order for them to change how not the organization is work, but like their interaction with these clients. The strategic alternatives would be to hire an outside organization to work on the goals and mission statement. And another one would be to have employees like gather a small group of staff members and have them work on a new mission statement and on a new set of goals. But like when hiring an outside organization, they might not have a good view of what Homeport is, so it might be difficult for them to change it the way Homeport will want. And if we set a group of employees from the organization to do this work, that means like there would be an extra workload for them, because they would have to work on new goals, a new mission statement, plus they would have to also work on their daily duties. For implementation, once they get the new mission statement and the new goals set up, first the organization has to make sure how they send this message to the new clients and the current ones, because you cannot just tell that old client that you're going to change everything dramatically, that you expect them to do new things. An example would be like before, like Homeport is always doing this like food drives, donations to their clients, and giving extra services for free whenever they can, because some of the clients are like have very low incomes. And then when Homeport requires like volunteers and stuff like that, like none of the clients will show up. So Homeport has to find volunteers from wherever they can, either from Ohio State or from like Children's Hospital or like whichever other affiliates or organizations they work with, in order to find volunteers. So changing the mission statement and setting new goals, I think the best solution wouldn't be to hire an outside organization, because it would cost them a lot of money and the organization might not get things right. So maybe making a small group of staff members work on this from a 5 to 10 month period, because they cannot change it right away. The faster they try to change it, the more work it's going to create for the organization. And since they're making a lot of revenue by increasing the workload on these individuals, that means that performance will lower. So they're going to end up having issues when everything starts to stack up. For the evaluation and control, at the end, I think the Homeport has to set new goals and a mission statement. They would have to find a time between 5 to 10 months to do it. They would control their measures by how fast everything is going, or like maybe like try every now and like try to implement that or share the information with other staff members or clients. That way they can see if the client agrees or doesn't with this. There was also a reward system, but the thing with the reward system, if you give someone a reward at the beginning or halfway through, they might slow down the process. That way they can get another reward before they finish. So I don't think that a reward system would be a smart idea for Homeport. And that's it. Any questions?
You may have said this at the very beginning, but where exactly do they receive their funding? Is it all just donations or
Since they're like privately owned and non-profit, like all their money comes from like either donations or from the government, because since they're helping low-income individuals, like they have to apply to get services from the organization.
Okay.
But they got over 100. Give me 1 second, I'll let you know. They have over like 100 community partners. So yeah, like they have a lot of like donations and things going. Like they're also partners with, they're also partners with like Children's Hospital. So before they move to their new location, which is like I don't know, like 4 or 5 times bigger, Children's Hospital donated like most of most of the furniture, like chairs, desks, and all that, which is really nice.
Okay. I've never heard of them. That's good information.
What kind of new goals would you implement for your evaluation and control for the Homeport?
I think like I would have them like at the beginning, once they like first, like the staff does great because they're like monitored consistently, so like there's no real goals that we can implement for like the performance of the staff, because all the staff like performs at their maximum every time, and they have like weekly one-on-one meetings, and I think group meetings every other week. But like the goals I would implement, it's like once they're interacting with the clients to explain what the organization expects from them, because like the organization is always given, and like even the staff members, like some of the staff members will go the extra mile in order to help their clients, but when you need like volunteers, none of them show up. Or where like if they have a community meeting, people will just show up and like sleep just so they can like sleep during the meeting so they can get those free supplies, or like not supplies but like food and whatever they're giving away.
Okay, thank you.
Yeah. All right, I think we're good.
I did my presentation on Fisher Titus Medical Center. Fisher Titus Medical Center is a nonprofit organization. Almost 2/3 of hospitals in the United States are nonprofit institutions because of the significant tax breaks that come with the nonprofit status. Nonprofit translates into massive profits. The medical center is known as a high-quality patient care, having received numerous recognitions, including the Health Grades Outstanding Patient Experience Award and Leapfrog's A Hospital Safety Score for 3 consecutive years. Because of our outstanding ratings and awards, it goes to show that Fisher Titus Medical Center truly lives up to its mission statement and are very consistent with each other. The corporate governance is, it starts with the board chair, and then it goes to the vice chair, the committee chair, board member, secretary, and the treasurer. Each member of the board either owns some shares of the stock or a large portion of the stock. To vote, shareholders are together or get together annually and vote on corporate issues. They also vote over the change in the healthcare's bylaws and can elect the board of directors. The majority of our board members are internal employees. One of them is including the emergency medical director over the emergency room, and is very knowledgeable in the medical background of the board, which can be very helpful in making the decisions regarding the organization. Other members are very wealthy and have other wealthy friends, which make up the donations that help us expand the hospital into more departments to make us stand out from other hospitals. External environment. Fisher Titus is located in Norwalk, Ohio, and it has a population of 16,833. Part of the external environment, the weather has a huge impact on our caseload. In the summertime, it is usually very slow at the hospital because I am a respiratory therapist, so we thrive off of respiratory cases. So in the summertime, our census are down. It's because our COPD patients are able to breathe in the summer, and in the winter it becomes very difficult for them to breathe, so our census are significantly higher in the wintertime. Because of the unemployment rate, people are able to come to the emergency room and provide insurance for their stay. If the unemployment rates were high, people would hesitate going to the emergency room because of lack of the insurance. And as you can see, in Norwalk, Ohio, the unemployment rate is 90.6%, which is pretty low. The internal environment, each and every one of the factors, the employee interaction with other employees, we have great communication skills within the internal environment of the facility. We have great interaction with management. They're always there to help. I really don't have any complaints about them. And then the manager interaction with other managers is phenomenal also. Each and every one of those factors are very important to the success of the company. They are important because of the things that are not running smoothly inside the company, such as producing product, management, and employee interaction. Then you would not be able to be successful outside the company. The analysis of the strategic factors, S obviously is strength, and it's the at Fisher Titus Medical Center, they have to offer the value of employees. Fisher Titus Medical Center always does an amazing job at making the employees feel as though they mean something and are valued. Some of the ways the organization makes employees feel valued is yearly raises and chances at low census. Sometimes when our numbers are down and we don't have that many patients, the management will give the employees options to take the night off, which can be very beneficial for people who sometimes need that mental health day. Some of the weaknesses of fasciitis is the morale between coworkers. Unfortunately, we do have a high turnover rate with nurses. It is the highest it has ever been. Because of the high turnover rate, nurses are expected to take a higher patient load, which can sometimes be unsafe, and then it overworks the nurses, and then the patient morale or the employee morale is definitely down. The opportunity at the beginning of each month, the nurses have a chance to sign a contract, and the contract is stating that you're going to pick up a certain amount of days over the 3 days that you're scheduled that month or that week, and at the end of the month, then you'll get the overtime, and then you'll get an extra bonus, which is, I mean, the bonuses can go up to like $1,200 to $1,400 every month, just picking up an extra day a week. Plus, you get the overtime on top of that. Some of the threats are within a 30-mile radius. There are at least four hospitals that are close to us. Because of how close the hospitals are, we are at risk of losing more employees, which has also increased our nurse-to-patient ratio, and we're at risk of losing patients to other hospitals. Some alternatives, by implementing these simple strategies, by allowing yearly raises, chances at low census, and signing a bonus contract, your employees are able to see that you're making small changes toward the ultimate goal, which will allow the employees to make you feel like their feelings and like their morale matters. And then implementation, some ways to address that is to meet with your employees, ask them what things can change, what things are working good, what changes they like, what changes. People obviously do not like change, but allowing meetings to implement the change, it will be very beneficial. And people that can be in charge of meetings is your CEO, because rumors do get started, so may as well go to the source of all the rumors and just talk to the CEO and ask them the questions that you have. And that's it. Do you guys have any questions?
Why do you think there is such a high turnover rate there? Do you think it's the pay?
Because of unfortunately, we admit a lot of like chest pains and observation people, and they are admitted for maybe 6 or 7 hours. The nurses have to do all the registration. They have to do all the medication history. I mean, all the complete admission history. And then 6 hours later, they're turned over and they're just discharged. So I think the nurses, on top of like taking a big caseload, I think they're just overworked. And obviously, I mean, the pay is probably comparable to other places. So if you can work less at other places and get paid the same, I mean, I don't blame them for leaving.
Yeah, my sister, it's a nurse, and we were just talking about this on a few days ago. She was telling me about how like sometimes she gets like a huge workload and she has to like deal with it because there's nothing she can do about it.
Exactly.
And then she's like, I guess she's moving to another state in the next few weeks because some other hospitals have a better system and
Yeah.
she gets paid more and has a less amount of patients per hour.
Yeah, I think sometimes it's very unsafe, but sometimes they'll get up to 5 or 6 patients a night. And I mean, that's not good patient care. And I mean, how can you give your attention to all 6 of those patients, especially if they're like complete care? So it's just hard. It's very frustrating for them, and they're very overworked.
Yeah, she was also saying how like some of the patients will complain about the nurse, but there's really nothing the nurse can do about it when she has to
Exactly.
take care of like so many people in like 1 hour or one night.
Yes, and sometimes the patients don't always understand that, but I mean, it's sad.
Are they, do you have a patient like nurse ratio that they do you have that on hand that they
They
normally
like to do
follow?
like 3 patients per nurse, but unfortunately, it's not always like that. We have call-offs. I mean, I'm sure every organization that you guys deal with, we have a lot of those, and then we have people who don't want to come in because, I mean, they're just so exhausted by the time they work their 3 days that week. So that's why they've been doing that contract. They're trying to get more people to work for, you know what I mean, to pick up because they're so short-handed. But some nights, like I said, they do like 5 or 6 patients per nurse. And they have like one STNA for like 30 patients. No, probably for like 10 to 15 patients.
Hmm.
Do you guys have any other questions?
I'm good on questions.
Okay.
I'm good, yeah.
All right. Thank you.
Devin,